During the COVID-19 pandemic, it is important to keep track of your clients who may be affected by this disease. To assist with this, your HMIS has been updated with a new assessment. This assessment is less about HUD requiring information from you and more about offering guidance and support during this pandemic. That said, the data you'll be entering into this assessment can help to find any individuals that have been affected by this pandemic so that we can communicate this to local public health officials and potentially get you more assistance. Please note that this assessment is not designed to replace pre-screening questions and temperature checks of incoming clients. While it is not necessary to do this for every single client during the intake process, you should attempt to do so for any clients exhibiting symptoms during the intake process, whether they are new clients or they've been there for a while. Let's take a quick look at this assessment in the system. To access the new assessment, click the Client Point option on the left side of the screen and simply open an existing client or add a new client, just as you normally would. Don't forget to select your EDA or Enter Data As for the program that you are working with. At the Assessments tab at the far right of the screen, click the drop-down for Select an Assessment, and you should see the COVID-19 survey. Of note, not all providers will have access to this assessment initially, so if you do not see this assessment at this time, that is okay, but this may change as time goes on. Select the assessment from the drop-down list and click Submit. The first question asks if the client is experiencing common COVID-19 symptoms. If so, you may inquire when the symptoms began, when the client began their isolation and/or quarantine, if applicable, and if the client was hospitalized. If the client has already been tested for COVID-19, you may inquire if the test was positive or negative. Follow-ups to this question ask when the client was tested and when results were provided. The next question asks the client's current symptomatic disposition. Put more simply, if they have symptoms or if they have been confirmed by a medical professional as recovered. If confirmed recovered, please list the date that a medical professional confirmed this recovery. Otherwise, list the current date if the client has selected currently symptomatic or no longer symptomatic. You should also attempt to collect any documentation regarding the diagnosis if the client states their healthcare provider has confirmed them as recovered. An area at the bottom allows for clinical health notes. This area will commonly be used by medical professionals such as physicians and nurses. Once you have completed this assessment, click Save to file the assessment. If a client's situation or symptoms change, you should submit a new assessment. This way, it will be easier to keep track of which clients are getting better or worse as time goes on. If you have any questions about this assessment or any other HMIS related questions, please don't hesitate to reach out to your Big Bend COC at elayton@bigbendcoc.org or at 850-739-5163.